Hello, my name is Dr. Nicholas Cohen, and I'm here to share with you a top 10 list of tips for people who think they might have or who want to prevent getting carpal tunnel syndrome. First tip is to maintain a healthy body weight. Obesity is a risk factor for carpal tunnel syndrome. So it's important to maintain a healthy body weight to prevent carpal tunnel syndrome. To find out if you're a healthy body weight, Google BMI calculator. Your body mass index uses your height and weight to calculate a number. If the number is between 18.5 and 24.9, then you have a healthy body weight. If your BMI is greater than 25, then it's important for you to lose weight in order to prevent carpal tunnel syndrome. There are also many benefits to losing weight besides reducing your risk for carpal tunnel syndrome. Two important components of maintaining a healthy body weight or losing weight are regular exercise, at least 30 minutes a day, and a diet that is not high in calories. Tip number 2. If you have a condition, a chronic medical condition that can lead to carpal tunnel syndrome, then it's important to control that condition with the help of your doctor. The 3 most common conditions that can lead to carpal tunnel syndrome besides diabetes, besides obesity, are diabetes, hypothyroidism, and rheumatoid arthritis. So if you have diabetes, hypothyroidism, or rheumatoid arthritis, it's important for you to treat those conditions with the help of your doctor. Tip number 3. If you suspect that you have carpal tunnel syndrome, it's important to see a doctor to confirm the diagnosis. Usually, if you have carpal tunnel syndrome, you'll experience numbness in your thumb, your pointer finger, your middle finger, and this part of your ring finger. So you'll experience numbness and tingling, and it's usually worse at night with carpal tunnel syndrome. Your doctor can do a couple of physical exam tests to confirm the diagnosis. Tip number 4. If your doctor does confirm that you do have carpal tunnel syndrome, the number 1 way to treat it is with nocturnal wrist splinting. In other words, having a wrist splint at night. A wrist splint either can be prescribed by your doctor or bought over the counter. It will keep your wrist in generally a neutral position, so your wrist will not be flexed or extended. It will keep your wrist in a neutral position at night. It typically takes at least a month for you to experience relief, so it's important to try the wrist splints for at least a month. And you can also try the wrist splints all day if just nighttime doesn't help. Tip number 5, carpal bone mobilization. If you have tried the wrist splinting for a month and you have not had improvement in your symptoms, then you can try carpal bone mobilization or yoga, which I'll talk about next. Carpal bone mobilization can be tried for 2 months in addition to the wrist splinting that you've already tried for 1 month to see if there's an improvement. Carpal bone mobilization are exercises that are done by a physical therapist or an occupational therapist. So that would require a referral from your doctor if you are not able to schedule an appointment yourself. And carpal bone mobilization has been shown to improve symptoms of carpal tunnel syndrome. Tip number 6, yoga. If you have tried the wrist splinting for at least a month, you can also try yoga for 2 months in addition to nocturnal wrist splinting. If you do yoga, which focuses on upper body strengthening, stretching, and relaxation exercises at least twice a week, there's good evidence that you can improve the pain and numbness that are associated with carpal tunnel syndrome. So you could, after 1 month of nocturnal wrist splinting, do 2 months of nocturnal wrist splinting plus yoga and carpal bone mobilization if you'd like, or any combination of those 3 things. Tip number 7. What I described were conservative measures. following are more aggressive or interventional methods to manage carpal tunnel syndrome. The first is glucocorticoid injection or steroid injection. This is generally recommended if you've had symptoms after 3 months of conservative therapy. So you tried your 1 month of wrist splinting, and then you added the carpal bone mobilization and or the yoga, and after 2 more months you still have symptoms. The injections are typically done with methylprednisolone, 40 milligrams into each wrist, or if both wrists are affected. And it's not recommended that you do this more than once every 6 months. Tip number 8, oral glucocorticoids. If you refuse or are afraid of or decline injections of steroids, then a second option, which is not as effective but also has a benefit, is taking steroids by mouth. The generally recommended amount is prednisone, 20 milligrams per day for 14 days. Tip number 9, surgery. Surgery is probably the most effective way to treat carpal tunnel syndrome, but it's not always necessary. Surgical decompression is the procedure, and it's generally recommended if symptoms persist despite conservative measures, which would include the nocturnal wrist splinting, carpal bone mobilization, yoga, and steroids. So the surgery is generally recommended if all of those other modalities have failed, including the steroid injection twice over a period of a year, and you actually have documented median nerve injury that can be shown on electrodiagnostic testing. And tip number 10, believe in yourself. Carpal tunnel syndrome is an extremely common condition, and there are effective ways to prevent and treat this condition. I hope these tips have been helpful, and thank you very much for listening. Have a great day.